Jersey.
On the new Talk Radio 1450 WCTC.
7:09. It is hour number 2 of Jersey Central on a Friday morning on the new Talk Radio WCTC, the voice of Central Jersey. Good morning. It is Burt Barron. Coming up a little bit later on this hour, Somerset Patriots manager Brett Jody will join us. And a little bit later on today, too, we'll have our contest for the tickets for the North Brunswick Youth Sports Festival, okay? Well, the month of May just about over, and May is National Mental Health Month, where efforts are underway to raise awareness and just to kind of get the word out and elevate the level of awareness, if you will, about mental health in Jersey and really around the country. And joining me this morning, longtime, very good partner of WCTC, and we're talking about the renowned Carrier Clinic located in Belmead. Joining me this morning is the Chief Medical Officer of Carrier Clinic, just for kind of a recap on Mental Health Month. Good friend of WCTC's, Dr. David Buch, and let's welcome him back to Jersey Central today. Dr. Buch, good morning. It is Burt Barron. How are you?
Good morning, Bert. It's always a privilege to be on your program and to be able to chat with your listeners. Thank you.
Thank you. And all my privilege, of course, to speak to anyone from Carrier Clinic at any time. But Mental Health Month in May, just about kind of coming to a close. Efforts, of course, throughout the month to kind of educate people and raise the awareness of mental health. Did you say it was an effective month for May for Dr. Buch for mental health awareness in New Jersey?
We're certainly working on it. I mean, most people with mental health problems don't need to be in a hospital. Just want to underline that. But many people have anxiety, depression, substance use problems, and a vast number of people don't get help. And what we want to do is help people to learn about these things, learn about how treatment can be really helpful, not stigmatizing. So if somebody has questions, it's always good to ask earlier, learn earlier. There's just a lot of things that can give people relief, and I hope that people look into it, please.
It sounds to me like mental health can take on some different appearances and some different looks. You had described a couple of different things there. It's not something that's always a very easy, slam dunk kind of diagnosis, is it?
Well, I can say that there are, characteristic symptoms of anxiety that bother people. There are people who have had traumatic events happen to them, like some of our veterans, some people who've had traumatic events in their life. There are people who have anxiety all day long, every day, keeps them up at night as well. There are people with depression with the characteristic symptoms affecting sleep, energy, appetite, focus, your whole sense of enjoyment of the world. There are people who may get a little feedback saying, gee, maybe you should drink a little less. I mean, all of these things, there are some criteria that are helpful that you can find out about, or the folks here at Carrier would be happy to give information to people, because we'd like to keep people out of the hospital and get people help and stay in their homes whenever possible.
Sure, of course. That's pretty much the goal. Let me run a couple of names by you, Dr. Buch, some pretty high-profile names that are kind of making news nowadays. Let me go back to Brian Wilson of the Beach Boys. He was at the State Theater a couple weeks ago. He was a guest on this program sometime. His problems, his issues, very well documented. Is it possible to be suffering with some sort of mental issue but still be brilliant like Brian Wilson is?
There's certainly very good evidence that there's been many brilliant people. Ernest Hemingway had his depression and his drinking issues. Mr. Wilson has been an incredibly creative and artistic man. The whole point is that people can be as creative as anyone else. And interestingly, some mental illnesses seem to come with more creativity. People with bipolar disorder may be, on average, more creative than the rest of us. So there's no reason that the great majority of people can't be super productive with help.
And I guess from there, when you talk about brilliant and creative people, unfortunately over the weekend, and I can't believe that we lost him as a result of a crash on the turnpike of all things. John Nash, of course, the brilliant mathematician, who unfortunately we lost in that car crash. His problems, his issues, well documented as well. Was he ever officially diagnosed with schizophrenia? I mean, or was it just sort of one of these things that, well, we know something's going on, but nothing was ever officially diagnosed?
I mean, to my understanding, Um, I've never seen his records. He was diagnosed with schizophrenia. He had treatment. We're fortunate in that his life story became a renowned movie and has been a way for many of us to learn about mental illness and to learn about how treatment can help. He would be an example of a man with a very serious illness, schizophrenia, who still managed to make world-changing advances. I wish I knew more about the math, but clearly he made a major impact on the world.
Sure. Dr. David Buch is our guest this morning on Jersey Central. He's the Chief Medical Officer at Carrier Clinic in Belmead, and we're recapping Mental Health Month, which is in May here in New Jersey and around America. The trial going on in Colorado this morning, Dr. Buch, for the shooter in the movie theater, the Boulder, Colorado movie theater. His defense is saying that, he's got these mental issues. The prosecution is saying, well, no, he doesn't. Is this something that somebody can clinically fake? Is that possible?
Clearly there are very controversies in this kind of area, and there are people with controversy about their diagnosis. What I'd like to focus on is that people with mental illness are not more likely to be violent than other people. That frequently violence, even in mental health issues, is related to risk factors for anybody, like substance use. But the overwhelming evidence is that people with mental illness, even people with the most serious mental illness, are not more dangerous than other people. Clearly, if there's a way to decrease your responsibility, some people will be trying to obtain that. I don't know this gentleman's problems. And then there's the question of somebody may have a mental illness but still know that what they did was not the right thing to do, so it's controversial.
Just kind of written things that I guess he had written in prison, apparently about page after page after page of just writing the word why, which I thought was pretty interesting.
That I could not tell you what that means. What they're going to be trying to debate in court is really, did he understand that what he did was ethically wrong, which is above and beyond having a diagnosis of mental illness.
Understood. Dr. Buch, do you have another couple of minutes? I want to touch on a couple of other subjects after a traffic and weather break. You able to hang in there with us?
I would love to. Thank you.
All right. I appreciate that. We got more coming up with Dr. Jersey Central with the Chief Medical Officer of Carrier Clinic, Dr. David Buch, who was with us here this morning talking about and recapping Mental Health Month, which was for the month of May here in Jersey. Some new information this morning, Dr. Buch, a new study published in the journal Neurology, an increased risk of developing Parkinson's for people who have been diagnosed with depression. Is there a clear connection between the two?
At this point, this is just an association. In the same way that gray hair is associated with arthritis, we're not sure its cause and effect. There have been studies that also have shown that some people with other neurological illnesses have had depression described before they had the other neurological symptoms. At this point, the study would need to be repeated, and then sometimes also with neurological problems. They're changing gradually in the brain over a number of years, and it's unclear whether the depression is causing a problem or whether the depression may be a first sign of a problem. In other words, many people with Parkinson's disease are having subtle changes in their brain for a number of years before they ever have the characteristic tremor and trouble walking that people have with Parkinson's. But it is an intriguing finding.
In terms of our understanding of mental health, Dr. Buch, are we just scratching the surface, or do we have a pretty firm grasp and understanding of what's going on with this?
There have been tremendous advances, especially in the neurobiology of mental health, the connections between different parts of the brain, the very tiny neurological and chemical changes in the brain, but there's a whole lot more that we need to learn, and our treatments will need to continue to advance.
Excellent. Well, before we sign off and before we wrap up this segment here, I know there was a groundbreaking recently at Carrier Clinic. I got to see some of the ideas and some of the drawings of what's planned to the expansion there. How are things been coming along? Is it kind of ramped up after the winter?
It has definitely ramped up over the winter. We have a new building for our recovery center, which is really beautiful and sunny, and state-of-the-art facilities. We have 2 new units for our acute care unit that are going to be finished at the end of the summer. We want to provide the best accommodations and the best facilities for our patients, and we're really proud of our building.
Well, it's always a treat and a privilege to talk to you, Dr. Buch. Thanks for being on the show this morning. Of course, the Chief Medical Officer at Carrier Clinic. How does someone get some more info about the services offered at Carrier?
People can always call our main number, which is 908-281-1000. And our access center has a number of really nice people who can give you extra information.
Excellent stuff. Thanks again, Dr. Buch. Have a great weekend. Good to have you on the show today, sir.
Thank you so much. It's my pleasure.
All right. Jersey Central traffic and weather time. It is now 7:25. Traffic and weather every 10 minutes on the 5s on Jersey Central. This update is brought to you by Thomas Edison State College. Earn your graduate degree online.